Managing risks to the workforce. The NHS Risk Reduction Framework, which our team helped to develop, calls for workforce assessments. These will identify individuals who may have an increased vulnerability to infection or adverse outcomes from COVID-19. The Adult Social Care Framework outlines a duty of care for health, safety and welfare of healthcare workers, as well as for those using the services, and suggests that risk assessment is carried out for everyone. In particular, there is growing evidence demonstrating an increased risk of developing COVID-19 for ethnic minority staff, not only doctors and nursing staff, but those supporting the practitioners too, such as porters, cleaners and healthcare assistants. We've also shared challenges and lessons from the local lockdown of Leicester, the first area in the UK that had a second lockdown imposed in an attempt to curtail the spread of COVID-19 infection. These lessons included the difficulties of socially distancing in small multi-generational housing that is common in urban areas such as Leicester, the high proportion of workers from minority ethnic populations who have essential worker status, such as those working in transport, manufacturing or as care assistants. These workers face an ongoing threat of infection and cross-infection as they continue to carry out their work. The higher levels of social deprivation seen in parts of Leicester, where it is estimated that 1 in 6 residents experiences social deprivation. Higher rates of illness have been seen in these areas. Also, people with underlying health conditions, disability and lower life expectancy have been disproportionately affected by the COVID-19 outbreak. Our work reinforces the need to identify and protect vulnerable groups who have an increased risk of developing COVID-19. We have produced a series of videos about the link between ethnicity and, in particular, the risks for minority ethnic communities and COVID-19. Links to these videos are available below this film. Our team have also contributed to the discussions on the effect of the COVID-19 pandemic in care homes. Our Building Community Resilience and Enabling Independence theme lead, Professor Adam Gordon, has led the criticism of how care homes were forgotten and left to self-manage the effects of the illness on their already frail and elderly residents. Our COVID-19 care home sector study helps to link health services and care homes, as well as closing the knowledge gap between the two by providing information resources to the care home network operating across the East Midlands. Not all risks to the workforce caused by the exposure to the COVID-19 infection are physical. There is also the effect of continuing to deliver care during the pandemic on mental health and well-being. In our previous guise as NIHR ARC East Midlands, we funded work which led to the development of an online training resource for the psychological well-being of healthcare workers. It's free to access, and the link can be found below this video. We are also part of a large number of national collaborative research studies which are exploring the effect that COVID-19 has had on the NHS workforce, including the NHS Check study, which explores the psychosocial impact of COVID-19 on NHS staff, and the UK REACH study, which questions why NHS staff from minority ethnic backgrounds have been so adversely affected by COVID-19.